Good evening. Thank you for joining us tonight for our 18 News digital exclusive State of the Virus. Now, as cases of COVID-19 continue to rise across the country and our area, 18 News is giving you, our viewers, an opportunity to ask local experts your questions regarding COVID-19. Today, we're joined by Dr. Michael Scalzone, Chief Quality Officer for Guthrie, and thank you for joining us today, Doctor.
You're welcome, George. Thank you.
So, Dr. Scalzone, on Monday night, Steuben County reported more than 130 cases of the virus, and just between Monday and Tuesday, Steuben and Chemung reported 8 COVID deaths. So how are things right now in the hospital for you guys with these case numbers continuing to rise?
I think as we're seeing across the country, it really is putting a stress on our hospital facilities. We have adequate space right now, but it really is much more difficult than it was even a few weeks ago. As these new positives happen in the community, within a week or two afterwards, those that are ill begin to become hospitalized patients, and unfortunately, sometimes after that, we see fatalities.
So, Doctor, right now last week we talked about the Thanksgiving holiday, and right now a couple weeks removed from Thanksgiving and of course approaching the Christmas holiday, what are the concerns with those hospital levels for you guys in the hospitals with this holiday spike?
Well, as we feared, unfortunately, we have seen a significant increase since Thanksgiving. You mentioned what's happening in the community with the positives in the 2 counties, and we've seen a similar increase happen in our hospitalization rates. As a matter of fact, as we track this, we look at a week's worth of positives in the key counties around us, and we can see a very consistent change with that number in our hospital census.
All right, Doctor, now we have our first viewer question. This one from a viewer in Millerton, and they ask, when someone is positive and may have to get tested multiple times to get that negative result, does that new test get reported as a new case, or are these repeated positive tests broken up by that person's individual case?
So each positive test is reported separately. So when our county departments of health report positives, it could indeed be someone who had a previous positive and we're waiting until the negative occurs. That happens more on the hospital side than it does in the community, because we often need to test people repeatedly in order to get them back to their assisted living facilities or nursing homes.
All right, so this number of repeated cases, this is pretty low if it's only those hospitalized patients that usually have those?
It is. It's the minority of cases, and it's the same way we've reported it for many months. So the trends continue to be very accurate, even if it is a slightly higher number than individual cases.
All right, and Doctor, of course, last week we talked about the possible concerns of staying indoors with these shared living spaces in the colder weather. Now, some of these places in the state have mandated these HEPA air filters or purifiers to be installed. And Louise and Corning asks, how effective are these in stopping the airborne spread of COVID-19?
So it's a great question. What we do know is that theoretically, and when they're tested, the HEPA filters do prevent the vaccine from being further spread. However, that doesn't equate exactly to not having a risk by being indoors. It reduces the chances, but it doesn't eliminate them. So it's a very valuable tool, and of course we're looking for all the tools that we have to try to decrease the spread in the community.
Of course, and Dr. Scalzone, this week we saw Pfizer's vaccine finally begin to be distributed and administered to frontline healthcare workers and soon residents in nursing homes. What does the arrival of this vaccine mean to you and your colleagues, and when will you feel safe when it comes to taking the virus, or taking the vaccine for the virus, I should say?
Well, it's very exciting news, of course, and we've all waited for it. It is probably the most important tool in our toolkit to prevent further spread. We know that in the beginning, there'll be very limited supplies. As much as we've all liked to have more, there really will just be a limited number for the next few weeks. We anticipate the first doses sometime in the next week or so, but because this is so early, we don't know the exact numbers or the exact date. It truly is changing day to day. The best experts are suggesting that it's going to take till March or April before there are enough people in the community vaccinated to make a significant difference in the spread of the virus.
All right, and of course, Pfizer's vaccine is the only one that's currently approved, and Moderna's vaccine very close to getting that for approval. So when both of these vaccines come out, potentially others available, will people be able to ask for the Pfizer one or the Moderna one, or even know which one they're getting, or is it just kind of you get what's available?
Well, they'll certainly know which one they're getting for a couple of reasons. One is we'll be very transparent about which vaccine they're getting, and there's a slightly different schedule for it. The Pfizer vaccine is given in 2 doses 21 days apart, the Moderna 28 days apart. But we really believe that these vaccines are similarly effective and similarly safe because they have the same technology that is used in order to create a response. So people will need to have the same vaccine for both injections, but we think that the supply will probably be limited enough that there probably won't be a choice for most people. They'll take what is available.
All right, great information, Doctor. Thank you again for joining us today. And of course, we'll have more next week, especially on the arrival of the COVID-19 vaccine. And viewers, if you have a question regarding COVID-19 that you would like one of our local experts to answer, you can email us at news@wetmtv.com. And of course, we'll have more on the fight against COVID-19 on 18 News and mytwintiers.com. Thank you for joining us and have a good night.